Welcome back to Sleep Better TV. I'm Scott Drake and my guest is Dr. Steve Lawson. He is with the TMJ and Dental Sleep Center of Winnipeg. Dr. Lawson, in our continuing discussion here, talk about what a patient can expect to experience when they first visit you.
Well, patients are again referred here more often than not, and what we do, for the most important thing we can do is sit down with this patient eye to eye and speak with them. You know, what is your problem? What can we do for you today? I mean, even though I have a pretty good idea who I'm seeing here because we get all of the patient intake information well before I see the patient. It's all done electronically now, so I know who the patient is, how old they are, who they've seen, what their symptoms are, but that's good knowledge to have. But I need to sit down and say, Mrs. Jones, how can I help you today? Talk to me about what your concerns are. Talk to me about what we can do for you. So the first thing we do is listen to the patient and try to make some sense out of what we can do for them, because it's a pretty a lot of patients don't have much of an idea about what jaw joints are or what the relationships between the jaws are. So once I've listened to the patient and really heard what they would like from me, then it's a matter of stepping in, making sure that they understand in a basic way what's going on, why are you having these problems, what we can do, how we can help you. And then obviously at any even screening appointment or an evaluation, I'm going to do some muscle palpation. I'm going to check their airway. I'll do some imaging. Perhaps for airway issues, use a pharyngometer to measure their airway so I can have a true appreciation of whether I can affect their airway by moving the mandible forward. And this is really enlightening for the patient. You know, a lot of these patients, especially with airway issues, and all of a sudden we move the jaw into a slightly different position and we just ask them to breathe, and their eyes just open right up because, oh my God, I can't believe how much more air I have, the perception that I'm getting. You know, so the time spent with the patient is all about the patient primarily. And if I ever get behind with an appointment, it's not because I can't see the next patient. It's because I'm spending time that needs to be spent listening to the one who's sitting across from me right now. They're the ones who count.
And in many cases, in your treatment modalities, they're pretty non-invasive, and it's just a matter of, you know, finding what the problem is, right? Well,
exactly. I mean, and you hit the nail on the head. First of all, find out what the problem is and do a diagnosis. Let's be sure we know what we're treating. With chronic pain, for example, lots of head and neck pain can be the response to a problem in the neck or even in the lower extremities. So we need to know what we're treating. And it's nice to know that what we do is non-surgical, and it's conservative, and it's reversible. If you had a problem with your knee joint or your elbow joint or your finger joint, you know, and things where the parts were out of place, you're likely looking at surgery to realign the parts and put a cast on and stabilize things. But we can actually alter the relationships in the temporomandibular joint, for example, either for TND treatment or for affecting airway control and airway improvement. We can do that with an orthopedic appliance. It's not a mouth guard. It's not just a piece of plastic, but it is acrylic, but it's made specifically to manage a specific problem.
Dr. Lawson, thank you. I'm Scott Drake, and you're watching Sleep Better TV.